Isaac Fowler, and this is my Nursing 113 checkoff on sterile dressing checkoff. So the first thing we're going to do is we're going to check our physician's orders, and I've checked my physician's orders, and I have an order for a sterile dressing change, wet to dry for Mr. John Doe. My name is Isaac Fowler, and I'm a Bell State nursing student, and I'm going to be assisting your RN today, and you have an order for an abdominal dressing change. Can you give me your name and date of birth, please? And then we're going to ask them for any allergies that they may have, and then we're going to get them to rate their pain. And if they do have any pain, we're going to have them rate it on a scale of 1 to 10. And if they do have any pain, after that, we're going to administer our pain meds that they are prescribed accordingly. And we're going to wait 30 to 60 minutes after they've been given their pain meds to administer our sterile dressing change. And then we are going to ask them if they've had a sterile dressing change before. And for the sake of this video, they have not had a dressing change before. The next thing we're going to do is we'll make sure that we always do hand hygiene before we start working on our things here. We're going to gather our supplies. Just go real quick, go through my supplies. I have my sterile pad here that I'm going to be working on. Then I have my combine pad. I have 2 sets of 4x4s. We can have 3 just to make sure that you have enough to do it, but you most of the time can get by with 2. You wouldn't want 3 if you're trying to pack, if you're doing a packing, if you really need to pack on your wound. And then we have our saline flush in case we need to irrigate our wound to get our old dressing off. And then we have our clean gloves, our sterile gloves, our cotton tip applicators, our tape, our saline, and our culturette, and we are ready to start working on our sterile field. And while we're doing them with our sterile field, just make sure there's no silence or anything. Just we can be explaining what we're doing. While we're explaining the procedure to them while you're setting up your sterile field, which we're going to be replacing your old dressing, and we're going to replace it with a sterile dressing. We're going to get a wound culture and clean your dressing while we're at it, and any questions that they would have about the procedure we would answer. So we're going to pick up our pad here just straight up, and they all have a flat or a shiny side, and we're going to always lay it down on our shiny side. Make sure not to touch our sterile field or let our sterile field get contaminated. I believe normally our things are a little bit smaller than this, and we have more room to work, but just know that we wouldn't want anything touching this contaminating our field here. And we're going to start by opening all of our packages in a sterile manner, which is we never want to put our bag completely to our sterile field. We always want to be able to have our sterile field in eyes view just so we don't break sterility. And when we're opening our packages, we open them away from our sterile field and away from ourselves. And we are going to take our first 4x4s and dump it, making sure that's not touching the edges or anything, so we do not break sterility. And we are going to throw it away in our waste container. And same thing for the rest of our things that we have. We have our combine pad. We're going to open that away and dump it, making sure not to touch it and break sterility in any way. Same thing with our saline flush, our makeshift culturette we have here, and our cotton tipped applicators. So again, opening away from yourself and from the field. And while we're working over our sterile field, we'll make sure that we're not dragging our elbows or anything, breaking sterility. And we have our 4x4, our other 4x4s that we're going to be using. Again, sterile technique opening. And these, instead of dumping out, we are going to place our sterile field. That's going to be what we use our saline in to dampen. And then we are ready to start on our dressing. Now that we're ready to start on our dressing change, removing our dressing, we are going to perform our hand hygiene, and we are going to don our clean gloves first. Make sure before that we raise the head of our bed to a comfortable working position. And we are going to make sure that everything sterile is out of the way. And we are going to first go around our dressing here. We are going to loosen around it. Make sure that we're not tearing in any other point. And we're also, while we're doing this, we're going to make sure to observe the patient, make sure that they're not feeling any pain, or this isn't inflicting any pain while we're doing this. And then we are just going to pick it up and remove it, and we're going to stop and look at it. And we are going to be observing for coach, which is our color, our odor, our amount, our consistency, and how well the patient tolerated the procedure. And we are going to roll that up. And if it was saturated with a lot of blood, we would make sure to. If it was saturated with a lot of blood, and we're going to make sure when we are disposing of it that we want it in this way where we're putting our gloves around it. And if it was saturated with a lot of blood, we wouldn't be able to throw it in the garbage, but this was a relatively dry thing. If it was saturated with a lot of blood, we would want to throw it in the biohazard waste bag. And also while we are using, when we are moving, if the dressing is sticking a lot to the wound, we could take our IV or saline flush and moisten it around it to make it easier to remove. But we would also have to check that this was not a wet to dry changing, in which this is a wet to dry change, so we would not be allowed to use our saline flush. Next thing we'll do is, while we are cleaning, we want to make sure that we assess the wound. We want to assess the width, the length, and the depth of the wound. We're going to be checking for RETA of the wound, which is your redness, edema, emesis, drainage, and approximation. And when you're looking at the drainage, you want to see how much drainage there is, what type of drainage it is, if it's serosanguinous, or just what exactly type of drainage that is coming out of your wound. I'm going to do my hand hygiene, and then I'm going to don my sterile gloves. I'm going to make sure to open my package in a sterile way, that I'm only touching my flaps here, and I'm not touching my gloves. I'm going to start by putting my glove on my dominant hand first. So I'm going to grab here by the cuff, lift it up, and step back from my field so I don't touch anything. And scoop my hand in. And then for my non-dominant hand, I'm going to take the cuff like that and scoop it and step back. And making sure not to touch anything or touch the side of my glove, I'm just going to scoop in. And then I have my gloves applied. So now that we have our sterile gloves on, make sure with our saline, we've already put our saline and dampened our 4x4 gauze. Make sure we did check the expiration date and the saline was in good condition. So we're going to make sure not to touch any of the side of our container, and our saline and containers, I don't know if I mentioned it earlier, are to the side of our sterile field. And then we are going to take our 4x4 gauze and put it in a wonton like fashion and get any of the extra liquid out of it. And then we're going to go straight down the suture line. And then we're going to dispose of that, and then we're going to repeat it twice more, go into each side of the wound. And while we're doing this, we want to make sure not to touch the edges that we were just touching our 4x4 gauze to keep it sterile. My 4x4 is wanting to stick some. And when we are doing this, we want to make sure to we're going on the outside of it. Make sure that we don't that we are only touching up here, that we are not touching the part that's going to be touching their skin, and then we don't want to be touching their blankets or the patient's skin or anything. That we just want to be touching our wound with our sterile 4x4, because we do not want to break sterility in any way. And then we're going to take our last one on the other side and throw it away. And then per CDC guidelines, you want to take your you would like to take your culture after you have cleaned. So we're going to take our stick. We're going to take our culturette. We don't really have a culturette. We're going to take a culturette, and then we would just swab all the way down and place it back into our culturette, and then we would have our culture ready to send to the lab. And then we would set that aside. And then next we are going to take, since this is a wet to dry, we are going to take our wet 4x4, and we can just use 2. We could use more 4x4 gauze if we were packing, and then after that we're going to take our dry 4x4 gauze and put on top of it. I'm not going to use that since it came out of my sterile field. And put that on top. And then we are going to take our combine pad. Make sure that the blue side is up and cover that, making sure not to touch the sterile side that's going to be touching the skin, and then we would cover that up. We have covered our wound here. We are no longer concerned about sterility. So next we are going to just take our surgical tape, the paper tape, and we're going to window pane. I'm just going to kind of measure here against it. And once we're done with this, I'm going to use a separate piece of tape just because I feel like that's the most, that is the best way to keep from, so just so you can write on it, and that you can just put it on after you've window paned like this. I'm going to use a separate piece of tape at the end to put on with my the time and date, as well as my initials for the dressing change. In this entire time, you want to make sure that what you're doing is easy on the patient. You could take a piece of tape and go across the middle too. That's what I'm going to do with my labeled piece. I'm just going to put my name or my initials, the time 0900, and today's date, which is the 17th, 2020. And I'm going to place that on top of my dressing, just so that you would be able, that the next person who comes in would be able to know who did the dressing change and at what time the last time that they had a dressing change. So from there, now that I've wrote sterilities over, you just dispose of these gloves the same way that you would dispose of any gloves. Since I'm going to have to reuse these for later videos, I'm not going to take them off that way. I'm not going to take them off yet, but we're just going to clean up the rest of our station, dispose of everything that we do not use, dispose of our sterile field, and all over the rest of our materials, and make sure that the patient is in a comfortable position, that they have their call light in reach, and let them know that they can come, and that they just need to hit their call light if they need to talk to us, and that we were going to step out of the room to document the procedure. Next, Notice that I didn't show with my former me actually wetting it. So I know you're going to take your saline. You're going to make sure again that your saline is not out of date and that it is the right solution that you need to be using. And then you're going to pour before you pour actually, you're going to lip out a little bit just to make it sterile in your sink nearby, and then you're going to pour very slowly about 4 to 6 inches above your 4x4 pads, and then you're going to invert it and make sure that you're away from your sterile field when you're doing this. You're going to invert it and place it away from your unsterile field. And another thing that I forgot to mention about my unsterile field, or about my sterile field, is that you want to make sure to not have anything towards the edges of your sterile field, because the sterile fields, the first inch and a half of the sterile field is considered unsterile. We're done with that. We step out of our patient's room. We have hand hygiene to step out of our patient's room. We are going to do our documentation, and I'm going to read off my documentation. At 0900 on June the 17th at 2020, Mr. John Doe, who was confirmed by ID by name and date of birth, and was educated on sterile dressing change procedure, and was instructed not to touch his open wound when it was open. The old dressing was removed and he was taught as this old dressing was removed, his first dressing, and that this was his first dressing change. No allergies or pain was reported, and since there was no pain reported, we went on to removing the dressing. We removed the dressing and noted a slightly pink color and no odor noted from the old dressing. There was a small amount of sanguineous drainage on the dressing and a water-like consistency, and was tolerated well by the patient. The wound measured approximately 2 centimeters wide and 3 centimeters long and appeared to be very superficial. There was no redness, edema, osmosis, there was little drainage noted, and the sterile gloves were applied, and a sterile culture was taken to be sent to the lab. The wound was cleaned and dressed and replaced, and the room was cleaned, and then the dressing was replaced sterilely with initials and time and date wrote on the dressing. The patient was left in a comfortable position with call light in reach, hand hygiene, and exit the room. Isaac Fowler, RN.